So the collaborative will help improve on existing work by building up the network of expertise and support and coaching.
We can share skills, share ideas and reduce on duplication.
We can build on the work that we've already adopted around quality improvement by sharing that work with colleagues across Wales and learning from others and putting that all towards improving patient safety.
So I'm hoping to achieve being able to share improvement skills within wider teams and also helping with changing the culture across the organisation to have more of a patient safety and improvement focus and let that sort of just become part of normal day-to-day work.
Working together, learning from each other is really important. Organisations that are maybe further ahead could support other organisations who are at the beginning of that journey. And I think the networking is really important.
That's not just working collaboratively across teams and across Wales, but it's also about how we include the people that we provide services for in those improvement pieces of work.
This is the opportunity, and now is the opportunity, that we're coming together, we're working together, and we're helping creating a culture for improvement and patient safety in Wales.